Oh man, a quick pull, and without anesthesia it hurts, but you can be able to put it back in. Oh man, impaled into the abdomen with some rebar. There are so many things that could be injured. Oh, ripped out a bullet. Typically, we don't rip out bullets. We leave most of the bullets in. Video games, in real life, they're different. Hey everybody, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician. I work in many emergency departments in the LA County, and I've been doing this for 11 years. Today, we're going to review the healing animation scenes in the video games Far Cry. Oh, looks like he just relocated his thumb. Man, that hurts, but you can do it. You got to pull really hard to be able to do that. If it's a fracture, again, you're trying to realign this if it's displaced, but most likely dislocation. Ooh, tree branch to the leg. My best advice, most emergency doctors will tell you shouldn't be pulling anything out. Trauma surgeons will say the same thing. Once you have an object that's impaled you, you're concerned about what's injured on the inside, and if you rip it out, you might be doing more damage on the way out, as well as if there's an object there, it's basically blocking vessel from bleeding, so the minute you take it out, it's gonna start bleeding all over again. Oh, more dislocations of the hand. It looks like fractures. You need a lot more force to be able to pop all these back into place. But if it's a dislocation and you pop it back into place, you can go ahead and use it again pretty easily without much pain. If you fractured it, it's a little different story. You're probably not going to be able to have as much function as what it looks like in the video game. Oh, a nail to the finger. I've seen this many times in the emergency department. It hurts a lot. You could potentially pull it out. In that area, you really need to be able to be worried about the blood vessels. It doesn't look like you probably got the bone because it's in between. But again, if you shattered the bone with it, you need to splint it. A lot of these are dirty, rusty things. You need a tetanus shot if it's not up to date. And you potentially need antibiotics if it's a dirty wound. Oh, looks like a piece of metal or glass. Again, you got to be really careful pulling these things out. It can cause more damage than what was already done by injuring the vessels and the nerves and potentially even the bone underneath. And you can leave a piece in there. Oh, another piece out of the wrist. A lot of times when you rip things out, again, you're going to cause more laceration and then you're going to bleed out and then you can't continue on. So you got to make sure, one, if you do pull something out, you need to, we call tamponade, block the vessel, stop it from bleeding. Wires through the leg. Ow. He just throws it away like it's no problem. But again, you got to be super careful pulling these out. On the medial aspect of that right knee, just on the back side, you can potentially have a femoral artery come down into one of its branches, so you got to be careful ripping that out. Oh man, impaled into the abdomen with some rebar. Definitely do not rip that out of your abdomen. Extremities, hands, if you're in the middle of nowhere, potentially can pull it out. But in the abdomen or torso area, don't be ripping these things out. It's blocking anything from pouring out of whatever was injured. He's got it on the left side. Left side has your spleen, has your large intestines, your small intestines, and then again, ribs, your kidney on the back. There are so many things that could be injured, and then you just aimlessly ripping this out can cause so much more damage, and you can die pretty quick if certain things were injured on the way in. Oh, looks like he just ripped out his own tooth. People do this often. I've actually witnessed with my own two eyes, somebody ripping out their front two teeth. It wouldn't cause splattering blood like that, but it's painful. It looked like it was already broken, and I've actually seen people rip out their teeth on their own with their own two fingers. So you can do it. I do not advise it. Looks like fracture probably of the ulna and radius of the left arm. You can put it back in together, but it's going to be floppy. If you break both bones in that arm, it's not connected anymore other than the tissue around it and the muscles. You need to splint that. Oh, another impaled object right to the top of the thigh. No major vessels on that aspect of the leg, but you have muscle, you have bone. If you pull this out, you can cause a lot of infection. Oh, looks like trying to pull out a wound or a bullet. Again, branch out of the arm. Looks like major vessel. You see some squirting of blood. Don't advise it. A good bandage to the arm. He just had a nail again to the forearm. It could be in the bone or it could be between the two bones. One, a rusty nail, we all know tetanus shot is imperative. He's putting a bandage on it so it stops bleeding. If this were to come to the emergency department, we take an x-ray to make sure you don't have an injury to the bone, and then a medical professional, either a surgeon or an ER doctor, will take it out and make sure that there is no excess bleeding that needs to go to the operating room. Oh, shards into the mid forearm. You gotta be careful. On the underside of your forearm, there's major vessels there. You have your medial, there are major vessels to your forearm, your radial artery, your medial artery, your ulnar artery. You lacerate those, obviously you can bleed out pretty good. So you gotta be super careful taking that stuff out of you. Ooh, putting it back in. Could be dislocated. There are a ton of bones into the wrist that could be off, and a quick pull and without anesthesia it hurts, but you can be able to put it back in. Oh, dislocated thumb, that's your distal phalanx. You can put that back in. You basically pull it in the direction that it already is and then pop it right over, and you'll be able to have a functioning of your thumb back. This guy injures his hands a lot. Oh, and we got a forearm. If it's broken, it needs to be splinted, but you can be able to put it back in. You'll have a lot of swelling and a lot of bruising. Oh, you ripped out a bullet. Typically, we don't rip out bullets. We leave most of the bullets in. Video games, in real life, they're different. The video games and movies, we pull out bullets. In real life, typically, you leave the bullet in. You'll actually cause more damage trying to pull the bullet out. So you leave it in most of the time. Oh, see another knife to get the bullet out. You would potentially leave that in, but bullets typically don't just stay on the surface there. The amount of force, velocity, we know I'm not a ballistics expert, but most of the damage caused by the path, and they end up in all different parts of the body. And so getting it right from the surface there, if it's there, you can pull it out, fine, but it's not the life-saving action. Oh, he's got robotic arm. Got it. He's got a prosthetic, working his grip strength. Oh, so now he's got to repair this. Okay, all right, back to functioning well. And that can happen. You can injure a prosthetic arm. Most of them, different materials, they're not high functioning like that, but we're getting into a day and age where people will have more electrical circuited type prosthetics, and should be really interesting in the future for people who've had amputations. Oh, injected some sort of medication into the arm to heal better. That could happen. Antibiotics, or even like epinephrine for strength, or there's actually medications basically to help clot. Could be anything. Oh, arrow to the arm, all the way through. A lot of times too with arrows or these type of objects, obviously you shouldn't be pulling it out in this situation, but when we do, you can't reverse the track because it's barbed, so you have to push it all the way through. Same thing when you get a fish hook in somebody's mouth, same thing, you can't pull it back through, you have to push it all the way through. Dislocated finger, that looks like a dislocation of the phalanx, happens all the time. You can do it without anesthesia, or you can do it used with. He's doing it without, and then the pain's gone immediately after. Wrapping his wound up. It's going to heal pretty well in this video game. Oh, he's on fire. You got to smother that out, and it's not going to cause any long-term potential issues if you get it out quick. Fires can cause first degree, second degree, third degree burn. Basically, a deep second degree burn or a third degree burn needs a skin graft in the future, but in the immediate injury, it's just going to cause pain on those levels. It's got a bottle of medications. Could be anything from painkillers to antibiotics to staying awake. Depends on what he needs at that moment. Scaling up pretty good. Would not fall, okay. Oh my gosh, okay, impaled object right into the face. Soft part, right into the eye, can go right into the skull. It could take a while to die from it, but painful, okay. A knife to the neck, again, hitting vital organs, potentially if you hit it on the lateral sides of the neck versus right down the middle. It looks like that could even go as deep as the spinal cord, which if you hit the spinal cord, you could potentially die pretty quick as it has no connection to the body. Oh man, a lot of trauma to the neck. Bunch of blood spatter can definitely kill somebody by having all that trauma to the neck. There's so many vital organs. Again, stabbing into the neck is, if you hit that carotid artery, it's going to take a little while for you to bleed out, but you will die if you don't get that fixed quickly. Ooh, head trauma, definitely snapped the neck, probably injured C1, C2, which severs your cord, has vital functions to the body, and might not be able to survive that. Ooh, shot to the lower leg, causes damage, but won't bleed out potentially from that area unless it goes into the abdomen. Oh, left shoulder, you're hitting the brachial plexus, you're hitting major vessels in that area. It could hit all the nerves. There's a lot of blood, nerves in the armpit actually, you'd be surprised, and it holds the whole function of the arm. So if you injure that area, that arm's basically obsolete. You won't die unless you bleed out from that area. Oh, pretty high. Oh, neck wound sliced across. Again, a lot of bleeding out. There you go, some head trauma. Again, you can have intracranial bleeding and skull fractures and cervical fractures. Oh, this guy definitely puts his knife in and twists, and that's basically to cause as much damage as possible to ruin the vessel. Because if you go in and slice it, potentially it's a clean injury. It might be able to seal itself, versus if you start twisting and ripping, there's nothing for it to kind of heal itself, so it'll just bleed and bleed and bleed. Oh man, okay, a lot of blunt force trauma. This looks like it's going right into the spinal cord, which if you have enough force, he uses two hands, which you need a lot of force to be able to go through bone. That could happen. More neck with a twist. Man, this guy just knows where to hurt somebody now. Gunshot, it typically doesn't splatter that much. There's not that much blood in the head. Even jumping on somebody from that height, one, you're going to injure yourself, and then you're going to injure the individual. You cause blunt trauma versus fractures. You can puncture a lung depending on where you land. Hey everybody, thanks for watching and joining me while we reviewed the healing animation scenes in the video game Far Cry. Those are really intense, a lot of brutal injuries, and you'd be surprised how many of those we actually see in the emergency department every day. They come in 6 a.m. in the morning or midnight. You see gunshots, stabbings, impaled objects, dislocations, fractures, everything, all times of the day. Check out more videos on Gamology YouTube channel and Facebook. When you see people pulling these things out, they're pulling it out of like their soft tissue, which we do. People always come in like, can you take it out? No, because it's too hard to get. You're going to cause so much more damage. Yep.